baby chiropractors.
Very gentle.
Was it scary to see him on the table? Up next.
Listen, I'm just going to put a little bit of pressure here on the right side.
Oh, he looks like he's pooping. One of the most helpless feelings a new mom can have is listening to a colicky baby. The especially tricky part is, what do you do if you don't want to medicate? Well, please welcome Karen and baby Eli, Emily, and her son Andrew. Yay! Okay, so wait, Karen, tell us about Eli. What was happening with him?
He was having a really hard time breastfeeding. From about 5 weeks old, we noticed that he was really kicking and scratching, and I was like, this can't be right for a young baby. And he was also not pooping every day, and so he was not happy about that. And so we called our birthing class instructor, and she recommended us to go see a chiropractor. And so we went and saw Dr. Licata in Arcadia, and he was amazing. It was like within 2 visits, a completely different baby, and he is a regular baby.
Really?
Yes.
He's regular, meaning he poops regularly.
Yes.
All right. And so you found that chiropractic care really helped. And
yes.
Andrew, you agree? Tell us, what was the issue with Andrew? Okay, they're the cutest things I've ever seen. Hi, blue eyes.
Andrew had he was in a lot of pain, and we could just tell because he was crying so much. So many sleepless nights. My husband and I were like, is something wrong with us or something wrong with the baby? We didn't know what was going on. And so after we had taken him to the doctor at 8 weeks, he got diagnosed with acid reflux. But I tried all the things the doctor had said.
That's the worst thing to have,
yeah.
right?
So I tried to keep him upright at 30 degrees. He's supposed to nurse upright and all those kinds of things, but nothing really seemed to help him.
So you also went and checked out Dr. Licata and the chiropractic care, and that fixed the problem?
Absolutely, yeah. Totally. He was totally a different baby afterwards. It was so helpful.
So was it scary to see him on the table at such a young age?
Yeah, a little bit at first, but he was so nice, and he really worked with us, and he explained everything that he was doing, and he's so gentle, and so it was fine. By the end, I was like, sweet, you got it.
Well, you know, we have the man here that changed your lives. Let's bring him out. Dr. Licata. Yay!
Hi.
Pleasure.
Hi, nice to meet you.
I'm so tempted to get on the table right now and have you like crack my back.
Right.
But how is it working with new babies?
It's great. I mean, you know, their nervous systems are on, overdrive. So the babies are doing so many things, and their bodies are changing. So we're just making sure that the connection between their brain and the body is open. And when that happens, they love it.
So why would, Andrew have acid reflux? Is it the way they come out the birth canal? Is it the way the birth experience?
Right. It usually has to happen with some type, a little small trauma, a very small injury. And usually it's when they're pulling the baby out, they turn the head a little bit too much. And the atlas bone, which is the bone that connects to the head, it starts to shift, and it shifts.
I know something about this because the atlas bone. I had a treatment done in Spain where they aligned my atlas bone, and it was incredible.
And you don't have to go that far next time.
No, do you do that? Do you do that?
So,
because the idea is that that's the top. I'm not a doctor,
right.
But it's right under your skull, and if that's off, it sets off every other bone in your spine.
Exactly. So there's about 5% of all the chiropractors focus just on this area. We're one of them, and so we deal 100% with that.
Okay.
So we're looking at that, and what we see is that when that shifts with the babies, the little muscle at the top of their stomach that's supposed to close to keep all the acid down gets a little bit loose, and so the acid keeps coming up. So their medical doctors start giving them antacids and all these other things. And so what we do is we just find
Will you show us what you do?
Sure.
All right, which one wants to go first?
Eli will.
I will. Okay. All right, Eli goes first. Okay.
Okay. So we're going to lay him down on his back.
Oh my God.
It says. Good. So one of the telltale signs that a child is misaligned is usually one side of their body, the muscle tone is going to be a little bit too tight. Okay. So we're going to look around the neck, and we're going to feel there, and my hands are freezing, sorry buddy. and we're going to see that on the left side, he's got a lot more muscle tone, his shoulder's not too happy. And so the other thing we'll do is I'm going to just check here. Usually I'd be standing a little bit lower down, but we look at the leg tone, and what we start seeing is that actually one leg seems to actually be pulling tighter than the other side. And with him, it's his left side as well. So what we would do with him is we would do a couple other tests, and we may do it with Andrew, but what we would do then with him is we end up putting him on his side. And all it is, it's a little headpiece. His head rests there, and we're going to do a little gentle correction right underneath the ear.
Okay. So can you do that right now?
You guys ready?
Yeah.
Okay. All right.
Is he ready?
All right. If he spits up on you.
Okay, he is such a good baby.
Okay.
Yes.
So
now that he's seen the chiropractor.
Yeah. Okay, wait.
So we're going to hold there. Mom, you can hold him on the side. All right.
Wait, can I sit here?
Good.
Oh my.
And all we're going to do is contact this point right here. It's a little part of my hand, and we're just going to do it very gentle. Good.
Is that it?
That's it.
That's
all
it.
right. Come on back. Good. And what we would do is then we would do a couple other tests, but we just recheck the muscle tone, and immediately the reflex turns off, the muscles start to release, and they balance out really well.
That is amazing. That's amazing. Okay, does Andrew want to go next?
Yeah.
So how often will you see babies?
So we start with we'll see them about 5 times.
Okay.
And they'll usually respond by the first couple
Look at him.
times.
Oh my gosh.
So with all right. So with Andrew, he's a little bit older. So what we're going to do is do another test here too. And again, the muscle tone has to be equal on both sides. So say hello. All right, yeah. And so one thing we'll do is we'll make sure he's tracking well. So he's looking at you there. Let's make sure he turns his head well the other side.
What is he looking at?
He's like, wait a second. And so sometimes they won't turn as
Andrew,
well.
I'm over here. I'm over here. Hi, Andrew.
So his head isn't tracking as well to the left. And so what we would do too is take that into account. The other thing, we'll hold him. There we go. And both
Andrew,
sides of his
Andrew.
muscles.
Oh my God.
He likes you. All right, he likes you a lot. So we would check the tone back here. He's like, how you doing?
He knows his camera. He knows.
So what we're going to do is we're going to put him here. And so since he likes that, I'm going to do now a very gentle
Hi. Wait, are you? I'm
And
like
I'm
taking
gonna
the place of Mom.
and all I'm going to do
Oh, he
now-
looks like he's pooping. He is, right? You're right.
Probably, yeah, they get that little look in his eye.
So what I'm going to do is contact the same atlas, and I'm just going to put a little bit of pressure here on the right side.
Oh my
And it's just very gentle. I mean, it's almost like nothing. It's about knowing where to do it. And then we recheck him. We would see him again, see how he's moving his head, see the muscle tone. And usually after a few visits, the parents are coming home or coming back and they're telling me they're feeling better.
That's amazing. And so what's the earliest you'll work with a baby? How new?
I have 2 kids, and they were right out of the womb.
So you started doing treatments on them
And so the youngest in the office was, I think, about a few weeks old.
Amazing, amazing. Thank you so much. And your babies are the best babies I've ever seen.